Thank you for joining us. I am Andrea Abajouti, and today we're going to be interviewing Aaron Kuhn. If you want to tell us a little bit about yourself, your profession, be great, and we'll just get right into it.
Yeah. Well, I've been in the field of psychology for probably 22 years or so. I have a PhD in general psychology, as well as a licensed professional clinical counselor, as well as a licensed addiction therapist as well.
Okay.
I do play therapy as kids as young as 3 years old. I do marital therapy, addictions counseling, anxiety, depression, any mental health disorder.
Sure.
We treat here at Counseling and Consulting Services.
That's awesome. In your experience then, how can we as a community challenge our friends and family to start taking control of their own mental health?
One thing I try to do in the community, and whenever I get an opportunity, I try to increase knowledge. That is so much in need. I just think people just don't know. Over 300 million people struggle with depression.
Yeah.
And we just don't know enough about it. Loved ones don't know how to help. Individuals who have it oftentimes feel like they're out of control, and sometimes aren't sharing about their experiences.
Yeah.
So sometimes just increasing your knowledge of signs and symptoms so we can be proactive and assist even when someone's not asking for help.
And as you talk about those loved ones, what are some things that they should be looking for so that they can notice a sign or a symptom?
For example, depression, one thing you'll see is isolation. Mm-hmm. Isolating into themselves, internalizing a lot. And even with some men more than women, they'll externalize, maybe become more irritable, maybe even rageful. So just those are a couple signs. Sometimes increased substance abuse because people depressed or anxious, they oftentimes self-medicate.
Yeah.
So they're self-medicating with trying to feel better. They don't know what steps to take, and unfortunately, sometimes chemicals of abuse work for the short term.
Right.
Those are some, even down to not being able to sleep or sleeping too much, just downtrodden affect. You can just see that there's not a lot of life.
Sure. Mm-hmm. And around here, all of those things are part of what we've come to understand as being a part of the stigma around it. Feeling that shame of seeking help. When is a good time to maybe suggest that? Or, how can a loved one say something to their family member or partner?
One thing that I try to educate people about is there's something called the writing reflex, R-I-G-H-T. We write people a lot, hey, you should be doing this, you should be doing this, you should be doing this. And it ends up inducing shame in the loved one, and they go more inside themselves. Mm-hmm. It's a chronic thing that we do, doctors, counselors, we say, hey, you should be doing this, or you need to be doing this. And in reality, when you're depressed or anxious, sometimes you feel so helpless and hopeless that writing someone only internalizes them even more. So one thing I encourage people to do is be a good listener. Ask open-ended questions. What's going on? Tell me about things. Those are some questions that we can ask our loved ones to try to show them that we are willing to listen, bring out their story. Everyone does have a story. And a lot of trauma induces some of these things. So just being able to avoid the writing reflex, or IGHT, and be able to just ask the right questions and just sit back, listen, attend, paraphrase back what they're saying so that they know that you're listening and validating their experiences, mirroring their emotions when they express them. Just being able to say, wow, you're feeling upset, you're feeling sad, you've been sad for 2 months.
Yeah.
And even following up with what's that been like for you?
Yeah.
And just bringing out that story. And a lot of us don't know how to do that. We think depression, anxiety, I don't know what to do, so I'll just avoid it. Mm-hmm. And sometimes we miss opportunities to help lead someone in that direction. Sometimes just listening and validating and mirroring emotions helps lay the groundwork for them being receptive for therapy.
Okay. That's really great advice, actually. And
thank you.
Since you've been doing this for as long as you have, how has treatment changed over the years?
Well, treatment is way, way less confrontational. When I started over 20 years ago, we used to use a confrontational approach with addicts, and what we find out today is that was the worst technique ever to use. So now we use what's called more motivational interviewing, which is less confrontational. We meet them where they're at. We ask open-ended Socratic questions like what and how questions. And we help them see the what they get out of their chemical use and then what they're not getting out of it. And they come to their own realization that they have to change, rather than us saying they have to change.
Yeah.
Or threatening them that they have to change. And sometimes just meeting them right where they're at, accepting them right where they're at, validating them without shame increases that relationship and that rapport. And in that relationship, healing occurs. In fact, what we've studied in psychology is that garnering a relationship with your client is the best way to facilitate change in clients. And the cool thing is if you do that, therapy works like roughly 95% of the time.
Wow.
And it does the same thing as what psychotropic medication does. It helps with dopamine, serotonin, and norepinephrine levels. It just, it's amazing what talk therapy and relationship-oriented therapy does.
Now, have you been seeing success with that? I mean, of that generation of, cut your ties,
yeah,
leave them be.
Yeah.
They have to understand, let them hit rock bottom.
Yeah.
How has that evolved?
Well, relationship, in my opinion, is the only way. We're a Christian private practice, and I think of some scriptural wisdom, faith, hope, and love, and the greatest of these is love. And when we just love, listen, and validate our clients, and we have appropriate boundaries with them, it's the only way to facilitate change. The only way.
What are some of the challenges facing professionals these days when it comes to treatments, therapy, things of that nature?
One thing that frustrates me is we have wonderful licensed professional clinical counselors here, and unfortunately, there's a law that says that we can't treat Medicare clients. So one thing that we're trying to do in the profession is lobby to those that in power to let us treat the geriatric population, because the geriatric population, there's increased levels of divorce and separation, there's increased levels of opiate addiction because of pain and things like that. So that's one beef I have, kind of we're hamstrung by, is just some laws. And also veterans, LPCCs aren't able to treat veterans. So if I have to, if I'm lobbying to treat a veteran, I have to, the veteran has to basically beg to see a clinician that they want to see. So I think we can do better with the geriatric population. I think we can do better with serving veterans. Those are the couple things that really, really, I think could change. Yeah,
I'm glad you brought that up. I have a family member and know a lot of people that have served in the military, were deployed, come back and face that PTSD, and they hit a wall at one point. Is there something that we can do to assist them or make that valid for them?
Yeah, what we do in our field is we call our senators, and we just basically leave a message of, hey, we're advocating for LPCCs to be able to treat these veterans and those that are on Medicare, and if we annoy them enough, maybe they'll let us treat these individuals. And I supervise LPCs. and their training, we are able to treat those individuals. And treating veterans might mean we have to go and get some extra education, but we're willing to do that because, especially in rural Ohio, it's hard to get a clinician that maybe is specifically geared towards veterans.
Sure.
And I just think we have very capable individuals here that can serve. Let us serve.
Yeah, and I've noticed, like I said, some of them have sought out that treatment, but they could be seeing someone that's several states away.
Yes.
Through a screen. Is that human connection going to be the same digitally, or what are your feelings on that?
The jury's out on that still. They're doing it's early groundwork research on those kind of things. To me, I'm biased for the actual brick and mortar, face to face, because nonverbal communication is 60 to 80% of communication.
Yeah.
And sometimes a client is telling me nonverbally something's going on, and if I maybe can't see those nonverbals, I'm not able to get as deep clinically as I need to. Just as simple as a client that's in session crossing their arms, they're guarded, they're defensive, and maybe they have some sort of trauma that needs to be released, but it's not ready to come out yet. Without being able to see those kind of things, I don't think treatment can be effective. With that being said, I love research, so if the research tells me otherwise, I'm open to looking at that too.
That's awesome. And when you talk about trauma, how has treatment evolved around those types of traumatic events?
I think we're getting much more trauma informed. I'm on a mission, as a person that does play therapy as well. Anytime I get invited to do a presentation on trauma, I want to go because trauma does some really, really amazing things to our brain. In essence, when we're traumatized, we don't have brainstem regulation like we need to, which without brainstem regulation, we don't get to turn on our frontal lobes, which regulates emotionality. And there's something called the amygdala in the limbic system that actually is where fear and anger live. So if we don't take into consideration that chronic ongoing trauma rewires the brain, basically, where a child or even an adult is functioning more out of their limbic system, specifically the amygdala, they don't have the brainstem regulation to turn on their frontal lobes. Therapy actually starts to rewire that. Oh, wow. Yeah. So I try to advocate for that because we have kids maybe in a school system that are rageful, and what we end up with all kinds of trauma. They don't know how to regulate their brainstem to turn on their frontal lobes, so their limbic system, and specifically the amygdala, is driving them. Yeah. So what we end up doing sometimes is maybe calling the police, and then they're re-traumatized, and that unfortunate re-traumatization occurs, so we never really help the brain heal. Wow. So what we have to do is educate people to do trauma-sensitive type of interventions. Like there's a saying, be parallel proximal patient with a person with trauma. Rather than authoritarian over them, we get on their level. We're proximal, close to them, but we're not over pursuing them all at the same time. We're patient with them as they regulate through. The body naturally will regulate. With trauma, it's going to take a lot longer to regulate. So just knowing parallel proximal patient, don't over pursue. I can just be in the moment with that person and not re-traumatize them. Just knowing that little bit of information can help a person with major trauma issues and psychological issues, depression, anxiety, bipolar disorder, ADHD. It can really, really promote healing. And all it takes is educating people that have interaction. And I'm not talking ill will to those who aren't educated. We just got to get out there and inform people. And once they see how awesome it is and how much it works, they'll want to use it and learn more.
Now, can people that maybe haven't experienced that same trauma still be able to give, that parallel proximal patient? Yes, yeah. How are we able to identify that and have that that relationship with the trust is really where it is.
Yeah, over 22 years of experience definitely helps me be able to know when to implement those techniques. So it will be harder to know little things with trauma just to keep an eye on. It is you might have a kid or adolescent or adult just isolate into themselves, or they might be rageful. And rather than power struggle with them, I would mirror and reflect, just being able to say, you're upset, you're frustrated about something, tell me about it. And I'm open, and that automatically regulates them. And also, if I concentrate on my own breathing and I have my heart rate regulated, it's something called co-regulation, just sitting with someone proximal to them, and me concentrating on regulating my own self can regulate them.
Wow.
There's a reflective mirroring process or parallel processing that occurs. So people automatically mimic in that moment. So it's pretty amazing, and it definitely will be harder to know when to implement that. Maybe if you've never been traumatized,
right.
or maybe you have stereotypes in your own head, like that kid's bad, or he's a loose cannon, and we end up not considering their story.
Yeah.
Whenever I have someone that's maybe mean and irritable and rageful, I'm always curious, like, oh my God, there's a good story. There's an amazing story in there.
Yeah.
And I love stories. That's why I love doing what I do.
Sure.
And just sitting back and bringing out that story. It's amazing because there's something called catharsis that actually heals them. When you bring out a story and look at it, and you look at it again and again and again, it becomes less threatening.
Yeah.
So people with trauma, they don't want to get that story out there at all because it's so scary. But once you expose them to that story and you sit and you're like, wow, how'd you survive in spite of all this? They start thinking, well, I am a survivor here. I've never looked at it from that perspective. So just exposing that cathartic release is healing. And I always tell people, if you don't know what you're doing, you maybe haven't experienced trauma yourself,
right.
Just love them, listen, validate, stay parallel with them, don't power struggle, and just sit back and affirm and validate, and they'll regulate. It's pretty amazing, how it occurs. Yeah.
Yeah. And now you have talked a lot about play therapy. Can you explain that a little bit to somebody who maybe doesn't know?
Yeah, play therapy's basically, if you have a kid, it's 3, 4, 5, 6, 7. They're not going to do talk therapy. They're not going to have a conversation like this with us. So we have to use a natural forum for them to actually express, and that would be play therapy. It's really cool how it works. All my play therapy equipment are basically strategic. What I want is we something's called abreaction. Abreaction is where the child will act out what's going on. And I have certain play therapy toys that actually promote abreaction. For example, let's say, I have a kid with trauma that maybe witnessed domestic abuse at home. And I'll have what we call perpetrator toys, like dinosaurs with big teeth or something like that. And then you have figurines, like maybe a animal that could symbolize a mother or a father or whatever. And sometimes they'll act out. That perpetrator toy may start eating on the other one. They're abreacting what they've seen. They can't tell us what's going on, but they can show us. And in play therapy, we never lead them.
Okay.
Well, we mirror, reflect, validate, and track. So tracking would sound like this: the dinosaurs eating the gazelle.
Yeah.
And that would promote them to continue to play and abreact. And it also increases rapport and connection because I'm following their play. And you think about it, we have a lot of technoference now in society.
Yeah.
And we're guilty of letting the kids play by themselves. We don't do much interaction with them anymore. Some do. I'm not saying we all don't. We're all distracted.
Yeah,
but
absolutely.
Just getting down on their level and just tracking what they're doing just by repeating back what their action is. And if they get frustrated, just mirroring that feeling. Wow, you're really frustrated. You can't figure out how to fix the fire truck. They start. It's just like, you're following me, you're with me, and it's naturally healing.
And even a young child has the ability to understand.
Yeah, through play therapy. Yeah, they don't know what's going on, but we're building connection.
Yeah.
They're having a cathartic release. They're reacting out, and they get better. They become more regulated emotionally. Their relationships grow with their family, and it's through play. It's absolutely amazing.
Yeah, that sounds really neat. And I guess, have you noticed an uptick in parents looking to treat their children at a sooner age? I mean, where is that line of, hey, maybe this is puberty, or, do we really need to seek out some assistance?
Here we have 3 other staff members, and we all do play therapy, but we see kids as young as 2 years old.
Wow.
And what we do with a 2-year-old is we do something called filial play therapy, FILIAL, where we teach the parent how to do the therapy themselves once a week.
Oh, wow.
So we teach them how to do that, and we help them get the strategic play therapy tools and things like that, and they get to build that connection. And I'll do that with maybe parents that maybe have some developmental delay issues, or a child with ADHD, and a parent that that attachment is hindered because the parent's so frustrated with the behavioral episodes that play therapy actually builds that connection to where, and then you teach them on the side. You teach them techniques of how to developmentally age appropriate intervention. Rather than stop doing that, it's using what we call a technique called ACT, acknowledge their needs, wants, wishes, ideas, communicate the boundary, and then target alternative behaviors. Rather than just say stop, we're actually teaching them by acknowledging their feelings, communicating that boundary, and saying, hey, I need you to do this over here instead. It's way more effective in regards to childhood development and what we call executive functioning skills, like emotional control, emotional flexibility, things like that. So I will specifically work with parents probably the majority of the time to teach them those skill sets. And a lot of parents just don't know what to expect from their child,
Right.
I'm guilty of that even with knowledge. I asked my 6-year-old to do 5-step processes when he's 6, and he should only be doing 2. Yeah. And then I get mad when he doesn't do 5 right.
Exactly.
Yeah. So we just don't know enough. They don't come with a manual. And that's why I love psychology so much, is because, wow, I got a manual here. This is what to expect from a 6-year-old, so that I don't inadvertently traumatize them verbally. So just knowledge has empowered me so much. That's why I have a love affair with psychology. It just empowers me to try to do the right thing, because we're all fallible. We're never going to get it right. So striving for perfection is never going to cut it. Yeah.
Now, with the rise of social media, which is kind of how people assume that they're connected most of the time, do you see in adolescents, young adults, that playing any role in their mental health?
Yeah, I've looked at some research years ago about social media type of platforms, and what I found was that social media can be good to a certain extent, but if you don't have boundaries on it, then it can facilitate depression and anxiety and bullying and all kinds of things like that. So I'm all for it in moderation. I've heard I have heard pediatricians recommend no more than 2 hours of total tube time daily for a child, and some might say, wow, that's a lot. It's a matter of, and I've heard some parents an hour or whatever, just being able to police that, because you have some kids that have social skills deficits. And like a mildly autistic kid who really likes playing Fortnite. The only friend he's ever going to make in life is probably the friend playing Fortnite online.
Right.
Because they don't do well with interactive play. So being able to keep that part, but yet policing it enough to, okay, let's go over here and let's work on parallel processing. So that we can continue to do our therapy for the autism, so you can have reciprocal type of communication.
Yeah.
So it's all about moderation from my standpoint in regards to social media.
Yeah, no, that makes perfect sense, because anymore, I'm not from here originally. My friends are very spread out throughout the United States. Even my family is spread out throughout the United States. So sometimes I depend on it, that FaceTime interaction of being able to see each other. And I remember being a kid, and the only thing you had was the phone.
Yeah.
You couldn't see them.
Yeah.
So there is, I feel like, that fine line of, yes, I feel connected to you even though you're miles away, but there's people around me too.
Right. Yeah.
So, very interesting. I did throw some other things on here. You did talk about addicts earlier too. Is there a way that parents can reduce the chance of their child becoming an addict in life?
Well, if you have addiction in your family, my father was an alcoholic, so genetically, I have a 4 times greater likelihood of developing a substance abuse issue.
Yeah.
So therefore, I got to make good choices. Okay? I have to do some preventative type of things. So genetically, sometimes we're just given what we're given.
Yeah.
Now, you add environmental things in there. If you add trauma, any trauma, trauma doesn't have to be physical, verbal, sexual abuse. It can be a car accident or a bout with cancer or whatever it may be. That trauma can, coupled with a genetic predisposition, it can be the perfect storm for an addiction to occur. So I guess what you do, what I try to do is I talk, trust, and feel. So I talk openly with my young kids about my father's alcoholism. So I'm going to talk about that enough so they might, by the time they decide, they're going to have that in their head that, wow, Grandpa, I never met him because he's passed, and some of what helped to cause him to pass early was his addiction issues. Maybe I don't want to go there. So talk, trust, feel. We can't do that enough. And the research confirms that if you talk to your kids or adolescents about addiction, it reduces the probability.
Really?
Same thing with suicide. If we talk openly about suicide, or if we have an inkling that someone is suicidal, a lot of people are afraid to say, are you suicidal? Because they think that will facilitate them having the idea to do it. When in reality, if you just come out and say, hey, I'm afraid, you've been withdrawn, you've been isolating, I see some darkness, are you thinking of suicide? That reduces the probability.
Really?
Because it actually triggers them to think, wow, this is safe. So I can tell all about my death thoughts or my suicidal thoughts. And when they get it out, the chances reduce that they'll ever do it.
Wow.
It's pretty amazing. So I want people to talk about it. I always coach people. I do suicide. I train people to do suicide assessments or risk safety assessments. And I teach them, you attack it head on, very assertively. Are you suicidal? Because a lot of times we do it passively, like, hey, you're not thinking of doing something silly, are you? And when we say it like that, we're giving them the impression of, I can't handle it. It's too scary for me. So you better pack that back up inside and never tell anyone. So attacking it head on very confidently gives them the confidence that they can talk about it. And then we reduce the probability.
It almost sounds the same as the trauma. Getting it out there and putting it on the table. When you're looking at it from a distance, it's maybe not so scary. Wow.
Talk, trust, feel. That's huge in regards to healing.
That's pretty awesome. Getting back to kids too, do you ever see any indicators of a child maybe having a mental health issue? And when can you spot that? How do you spot that for our parents out there?
Yeah, I mean, depending on, if you want to talk adolescents, children.
Sure.
Would you rather? We haven't talked much about adolescents. Let's say adolescents, okay?
Okay.
Let's say this adolescent has a story, maybe a trauma story. Okay, maybe it's not ongoing. Maybe there was a history of trauma there. Maybe there's bullying, those kind of things. You take trauma and you add puberty, equals high risk.
Absolutely.
Yeah. So one thing that I say is keep your eye open for signs. That isolation, irritability. Girls, young adolescent girls, they'll internalize.
Yeah.
I stink at everything. It's me. Something's wrong with me. Or they might even start restricting food intake, or the makings for an eating disorder, stuff like that. Also, you can look for signs of regression. In adolescence, maybe they're, all of a sudden you wake up and they're lying beside you, on the floor in your bedroom.
Yeah.
So you could have regressed behavior as well. Affect, just the way they present themselves, the way they sit down in a chair, if they're melancholic and just slumped, and they're not smiling, and that's ongoing. Those are things to be aware of. And the thing of it is, we will have sad days. We will be anxious in life. Where it becomes diagnostic is where, time frame wise, like for example, depression, 2 weeks or more often than not, feeling sad, depressed, hopeless, helpless, loss of interest in things, thoughts of death or suicide, flattened affect, hypersomnia or sleeping too much, insomnia, not being able to sleep. And if that's 2 weeks or more often than not feeling that way, you are clinically depressed. And just knowing that, keep an eye on, is this consistent?
Yeah.
And if so, I act fast, because with an adolescent, they are especially boys, they're very high risk for suicide. And we have to act fast. Don't put it off. This is serious business.
Yeah.
And my viewpoint is no different than having a tumor in your head.
Yeah.
Go get it looked at. This is going to cause, this can cause death just as much as any physiological issue.
Absolutely. And do you ever find, maybe around the parents, that stigma of, oh, my kid's just fine. They are just going through puberty.
Yeah.
Is there a way that we can combat that?
Yeah. Denial is real. I mean, who wants to admit that one of your loved ones is struggling with a mental health issue? Number one, they're probably dancing with the stereotype. Number two is, I can't fathom my child in pain. So the brain's pretty powerful. It will go in delusional denial.
Yeah.
And what I do in those particular cases, I just listen to them, validate them where they're at, ask them those open-ended questions, not write them, RIGHT. Like, hey, you need to take him in. That may not work.
Right.
But being able to say, hey, what? Tell me more about this. What's your feelings associated with this? How's this impacted the family? So those Socratic questions, those open-ended questions to bring out the mom or dad's story, building an alliance with them increases confidence in you, and then they might be ready to say, hey, have you thought about maybe doing some talk therapy? What are your thoughts about that? Bringing out their story is going to increase, an alliance, and forming an alliance with them is going to increase them listening to a recommendation you might have.
Okay. Kind of to wrap up here, because I feel like we're I could sit here all day and ask you all kinds of questions. Is there something that you would want to drive home to any of your groups out there? The children, a 12-year-old, an adolescent, an adult, maybe a parent. What are some things that you've seen over the years that you would just really like to stick?
That's a tough one. There's so many different things. There's an acronym that I read about and I love it. It's called SMART. Okay. The S stands for sleep, schedule, stress. The M stands for medication. The A stands for adjunct treatment, and that could be yoga or mindfulness meditation. Could be meeting with pastor or priest. R is recreation and relationship. Being able to do some fun things that you like, and relationship. T is talk therapy. I think that says it all. When you have a serious psychological issue, it takes all of those. A holistic type of therapy. And I guess one one piece is not going to work by itself. If we just, in the SMART acronym, just doing the M, the medication, and you don't have the talk therapy, we don't have the skill set to be able to express our needs, our wants, how to regulate emotionality, have insight to how you're feeling. Talk therapy, that's what that's going to help you with. It's going to help you maneuver relationships and emotions and things like that. So all together, sleep schedule, stress, medication, adjunct treatment, recreation and relationship, talk therapy, holistic. That's when things go really well.
Yeah.
Now, if it's an adjustment disorder where you've had depression or anxiety, but it's not been ongoing, we might be able to hold on the M, the medication.
Yeah.
And do the other stuff. And then if not, then the worst case scenario is we go look at medications. And medications get a bad rap, so I'd also say stay off blogs.
Yeah.
The FDA is pretty stringent on how medications are assessed and safety wise. So I believe in that science as well, because I've seen it save lives.
And we were actually having a conversation yesterday about medication being able to clear the fog, maybe. And it might not be necessary in all cases, like you stated, but sometimes just to reduce that stigma around that. Just because you're taking a medication doesn't make you weak.
Right. And there's so many things we can figure out with medications. Like, for an example, an SSRI is what's called selective serotonin reuptake inhibitor. With depression alone, that can be very effective because it slows the reabsorption of serotonin, and there's more serotonin in the synapse, and we start feeling better. Now, if it's a bigger issue, like say you think it's depression and you're on an SSRI and you get worse, rageful, manic, now we know that, hey, we got a bipolar disorder here.
Yeah.
So now we need a mood stabilizer, And just knowing that information, I can then refer and recommend, hey, we got to inform the psychiatrist about this, that you're having a manic or a rageful response to an SSRI. I think maybe we're dealing with bipolar. So differential diagnosis is huge in regards to pinpointing the most accurate diagnoses so we can get the right medication. That's not easy clinically, because psychology is not an exact science. Sometimes it's a trial and error. Hey, I think it's depression. SSRI makes it worse. Oh, nope. It's bipolar disorder.
Yeah.
So it's a process. So I say don't get upset or discouraged if the first time we get a maybe not so good result. We have to fine tune it. As with me, I don't prescribe meds, but I work with psychiatrists and doctors to give them the information for them to best treat.
Great. Do you have any questions, Dan?
I do. We talk a lot, we've been talking the whole time about, I guess I would call them more severe situations. But, in life physically, we do things like, hey, you know what, I'm not sick, but my life would be better if I lost a little weight, or things along those lines. So when it comes to mental health, what can we do day in and day out? Just some tips to just be healthier.
Yeah. Number one is knowing how detrimental the righting reflex is, R-I-G-H-T. I'm going to say right off the bat, I think many people know what the right things to do are. Everybody knows they need to exercise, eat right, all those kind of things. So I say wipe those normal things away. I'm not even going to recommend those. What I'm going to recommend is find somebody who will listen to you and who will validate your story, who won't tell you what to do, who won't say that hey, go do this, so that you're not shamed back into your hole. I just say you got to start with meeting them where they're at, just listening and validating them without telling them what to do. And then once they have a relationship with you, they'll listen to you.
Yeah.
So that's the main thing is just love them right where they're at. We can also talk about faith. I love it when God shows up in research, because you think about the people who do best clinically are those that have faith, some sort of spiritual background. I'm biased. We're a Christian private practice, so God, Christ, people do better with faith. Now, if I have someone that is maybe agnostic or atheist, I'm not going to ram that down their throat.
Sure.
I'm going to meet them right where they're at, and I'm going to help them bring out their story of why maybe they are agnostic or atheist, and I'm gonna accept them right where they're at. So mine's going to be a little counter to what the normal would be. I'm not going to say go exercise, go eat right, because they already know that.
Yeah.
So I don't want to insult anybody's intelligence because they've already heard that a million times.
Absolutely.
I'm going to say go find somebody who'll listen to you. If you can't find somebody who'll listen to you the first time because they make it about them and they end up talking more than you, find somebody else. Don't give up. There are people out there that will listen to you and validate your experience.
That's one more though. It kind of builds on that. I can only relate to me.
Yeah.
But for me, making an effort to listen to someone else made my situation much, much better.
Yeah.
How does someone, is that one, common? And two, how do you, because for me, I felt like I was lucky.
Yeah.
How do you find situations where you can be the listener?
Well, you're talking about taking the opportunity to find someone who needs to be listened to and take that initiative to do that. Okay. You think about it, we're chronically so busy, we're not doing that. So an example would be, what do we do at Walmart when we see somebody? Hey, how you doing? Fine, we lie.
Yeah. Right.
So being able to see those observations of trouble and being able to make that initiative and say, hey, tell me about things. I don't want to be intrusive, or if I'm out of line, let me know.
Yeah.
Tell me what's going on. I've noticed that you've been more withdrawn and down. Tell me about it. What's up? And just being able to show them what you're seeing, which you're going to be right on. Everybody wants to tell you, okay? Even when it's horrible trauma, it's right there on the tip of their tongue, but they don't know how it's going to be perceived. Maybe they'll think that nobody can handle what I'm about to tell them. And just being able to sit across from them in a non-threatening way and just saying, tell me about things, I noticed this. And some of that is just slowing down and looking. Yeah. And finding the right venue. It's not going to be Walmart when everybody just wants to get out of there. Just having that venue to be able to do that in. Maybe it's at work. Maybe it's out to breakfast with a coworker. I don't know. It has to be the right setting sometimes as well. And I would say, if you have it on your mind that hey, I noticed this about this person, I should really talk to them. Turn your anxiety about that into action. Just do it. Yeah. Text them. Go meet with them. And sometimes you got to be demanding. Sometimes you got to say, hey, I'm picking you up at 10 o'clock and we're going to go to breakfast. Because you think about it, we do this at funerals all the time. We say, hey, if you need anything, let me know.
Yeah.
When do you ever get a call?
Exactly.
Never. But if I say, hey, I know you've been through a lot. You don't have to worry about returning the Tupperware. I'm going to have beef and noodles and mashed potatoes at your doorstep. And it'll be there at 12 o'clock. Enjoy. They're going to take that.
Right.
So sometimes we have to be in command. My motto is that I've learned, be in control without being controlling.
Advice.
And sometimes we have to do that with someone psychologically in need.
Awesome.
Did that answer that?
Perfectly.
Yeah. Thank you so much for your time today. We really appreciate it.
I love what you guys are doing. Mental health is near and dear to me, and getting the word out there, erasing these stereotypes, and just normalizing that this is disease that needs just as much as attention as any other physiological condition. So thanks for having me.